Welcome to Mededia. This is Tariq. So we're going to do another mock interview of another Mededia mentee. We have Dr. Ali here. Dr. Ali, how are you doing?
Hi, I'm good.
Go ahead, tell me a little bit about yourself, please.
So I'm a medical graduate from Pakistan, and I'm currently working as a postdoctoral research fellow at Beth Israel Deaconess Medical Center. My work here mostly focuses on hand motion analysis and simulation. What we do is we attach sensors on the hands of operators as they perform procedures, both on simulators and on real patients. And we try to see how they did in terms of motion. So it's very exciting work. Aside from that, I've also been working on lymphangiographies and novel techniques such as cone beam CTs, and also on novel techniques in ablation and debridement. All of this is very exciting to me. So right after my graduation, I did a 3 month rotation in neurology department in my home hospital, after which I came to the US. So I've been in the US for the past year. I've really enjoyed my experience here. The four weathers of Boston are amazing. In my free time, I like to read. So I've usually been partial to fantasy and science fiction, but as of late, I've come to appreciate the value of nonfiction, particularly enjoyed the works of Daniel Kahneman on thinking fast and slow and reading about stoicism. Aside from that, I love playing chess. I'm partial towards bullet and blitz, but I like a slow game as well.
Interesting. I see from your CV that you volunteered in Kim Collian's child education program. Can you tell me a little bit about this, please?
So that experience is very special to my heart. That is a platform that I was part of the founding team. So the idea behind it was that there were a lot of people around us, a lot of staff that could not afford to send their children to schools. Now, education in Pakistan is mostly government funded, but even then, due to socioeconomic conditions, it is very difficult for them to meet all the requirements, because it's not just the education. It's getting books, it's getting stationaries, it's accommodating for transport costs, and there's always the opportunity cost of them working instead of studying, which is very painful to see. So this impacted me. So this is why we started this platform. And what we did was we had charity drives and donation drives, which consisted of monthly commitments from students and teachers and other platforms, and we directed that towards these students who otherwise would not have been able to have the chance to complete their education. So in this way we were able to help students in nursery, in kindergarten, to even students, university students, and we were able to support their education. It was a very uh, humi- um, it was a very humanizing experience.
Interesting. And your work at Beth Israel, you mentioned that you're looking at hand motion analysis. Can you tell me a little bit? So what are you doing?
Okay, so it's very exciting. What we're doing is we're trying to see whether a person who is good at a task can perform the task with a better motion profile. Now, what does that mean? We have a couple of motion metrics that we use to define a motion profile. So one of those metrics is path length, the total distance a person moves his hands over the course of an entire procedure. Or we have the number of discrete movements you make, like, for example, a movement made up and down. How many movements do experts make less movements? And similar to this, we have rotational movements. Do experts rotate the hand less than trainees? So these are very interesting questions, and it's originally inspired from a groundbreaking experiment in surgery where they found that expert surgeons, required a shorter path length and required fewer movements to complete a task than trainees. And they also found that as trainees progressed through their training, their path lengths became successively shorter. We wanted to emulate that in interventional radiology, which is a very procedural specialty, but there's a difference in the motions that we see in interventional radiology compared to surgery. So we're not looking at really gross movements, we're looking at very fine movements. So there was a need to come up with new motion metrics that better describe the differences between experts and trainees in interventional radiology. And that was my role here. I was given motion data, and I was tasked with the responsibility to come up with motion metrics that were more suited to interventional radiology rather than surgery. And under the direction of my mentor, Dr. Jeffrey Weinstein, I worked on careful bench experiments, and we were able to conclude that rotational movements are a lot more important in interventional radiology. So we're moving forward with that.
Interesting. So what does your prelim data show? How can somebody transition from trainee to expert?
So the prelim data is very interesting because it's very encouraging. We are currently looking at central venous axis placement, and what we see is that experts do require they have a significantly different motion profile than trainees. And if we give feedback to trainees on how they rank compared to attendings, they can get a sense of how well they're doing. So it creates a sense of competition because they can see quantitatively how much better they're getting throughout their training courses. So we found that give feedback based on motion profiles was actually beneficial in helping them improve. So that was very interesting.
So for example, let's say if I'm a trainee and you're giving me a feedback on how to improve my hand motion and how to get more efficient with the line placement. So go
Yeah.
ahead, tell me, what would you say?
Okay, so this is a very data-driven task. So in your first trial, the first trial you perform, I would have graphs for that trial, and I would show you how you stack up against an attending. I would show you that an attending could do this entire task with a path length of about 700 centimeters, and it took you around 800 centimeters. So you did pretty well, actually. Just need small measures of improvement. And then I would note and I would give anecdotal advice based on what I've seen on attendings on the extraneous movements they made during the trial. But mostly it comes down to fine movements that we can't really point out to. Like there are no gross movements that change. It's just that their hand picks up those efficiencies as they practice more and more. And it's nice for them to see the progress. If they could complete in 800 centimeters in one trial, but in the next trial they got to 750, they see they're improving. And that actually encourages them to go down to 700 or even 600 sometimes because they're really motivated.
Interesting. So what you're saying is basically, so path length is how much my hand moves from one end to the other. Okay.
Yes.
So if my hand is moving less, that means actually I'm doing better.
That is what the evidence suggests, because
Interesting.
this will have to be coupled with subjective assessments, some form of subjective assessment, but we're trying to see the limits of objective assessments.
Interesting. So what are the subjective assessments you're looking at?
So there is a global rating scale that is used for these subjective assessments. It's used in surgery and other procedural tasks in which an expert at a task observes a trainee perform it and then ranks them based on 5 to 6 criterias from 1 to 5. So these assessments are more holistic, but these are very well correlated with our motion metrics. This has been extensively described in the literature that people who have a shorter path length and people who use fewer movements tend to do better on the GRS scores as well. So we're trying to see whether we can just use motion metrics to that end.
Interesting. And you also mentioned that you're doing some research on cone beam CT. Can you tell me a little bit about what you're doing with cone beam CT?
Yes, so that's a very interesting thing. So there are two major projects that I'm dealing with on cone beam CT. The first project deals with comparison of pre-transplant imaging. So we decided to see whether angiography with cone beam CT is equal or better than MRIs for the same purpose. It was a reader study in which we had two interventional radiologists and two diagnostic radiologists read all the imaging in a randomized fashion, and then we saw how the inter-rater reliability varied across the two modalities. So we were really interested in actually looking at the arterial anatomy more than anything else, but we also looked at the portal venous anatomy. We did not look at the venous at the systemic venous anatomy. What we found was that with cone beam CT, our readers could more confidence give accurate measurements for lengths and diameters of arteries. uh, the how it's useful, it's still debatable, but it is a difference that we found. And the other project involves looking at the evolving trends of cone beam CTs in interventional practice, because in cone beam CT is essentially a new modality that is picking up pace at centers. So at our center, we found that we were increasingly using it for biliary procedures. So it was just a high level review of where is cone beam CT being used at our center. And perhaps this research can inform later researches on what is the best use of cone beam CT.
Okay, interesting. And I see you had an oral presentation on predicting thermal injury patient outcomes in a tertiary care burn center. Can you tell me a little bit, like, so what were the outcomes that you found?
So that's a very interesting study because it was done in Pakistan. So most of the world's burn burden is in South Asia, in Pakistan and India, but most of the literature we find is based in Europe or USA. So we don't really know whether those models that we have box scores and such are really applicable to our population as well. So what we wanted to do was we wanted to come up with a model that was based on the specifics of the Pakistani population. The idea was this was the first phase in making a making a predictive model in Pakistan in a tertiary care center. So, and the use of the model was to predict survival and length of stay. And this could be useful in management planning and in counseling patients. So what we found was there were slight differences in, although the main thing, the total burnt surface area was the most important thing in our model as well. And that has been consistent across other models. We found out that hypoalbuminemia is a very important factor in our population. Uh, the reasons for that, there could be many reasons for that. And we're still exploring those reasons. There are actually further studies going on that. That's something very interesting, that sometimes biochemical factors can also be predictive in this sense.
Interesting. Very interesting. Thanks for sharing that. So I also see from your CV and personal statement that you are a class representative. Tell me something, one thing that you learned from being a class representative.
So being a class representative was a very interesting experience, because during the first year of my medical school, I sought knowledge, and I sought to become the best physician possible by knowing as much as I could. But when I was given this opportunity to become a class representative, I gained a much broader view of medicine and much broader view as a person of myself as well, because it put me in a position to interact with a lot of different people, and put me in a position to work in lots of different teams and to advocate for other people. And that really uh, made it very important for me to understand communication skills on and how to advocate for my colleagues, and then hopefully in the future advocate for my patients. So I think the learning experience and the way it put me outside of my comfort zone, I really enjoyed that aspect.
Okay. Why do you want to join our program?
Your program is a very strong program. The most important thing for me is the high case volumes that you guys see. It's a level 1 trauma center, so you see a lot of trauma. You've recently updated most of your imaging technologies. All of these things point towards is this being a very high volume center, and I want to be the best radiologist that I can be. And for me, my understanding is that the more I see, the more I will learn. Secondly, it's the incredible array of mentors and teachers at your center. It's an amazing center where you have incredible teachers, and I'd love to be under their tutelage.
Okay. So we have a lot of applicants, and we are interviewing more than 200 applicants. Among them, what sets you apart from all of them, and why should you be selected?
So that's a very good question, because undoubtedly you have a lot of good candidates. But I think what you're looking for is the best fit. What you want is someone who can work in your team, who is reliable, who is dependable, and who is consistent, who is a strategic planner. I believe that my experiences have led me to have all those qualities that will allow me to be a good fit in the culture of your program. So there are a lot. So given the fact that there are a lot of other candidates who are very well qualified, I feel that I may be the best fit for your program.
Okay. Do you have siblings?
Yeah, I have siblings. I have 3 younger sisters.
3 younger sisters. You're the only brother?
Yes, I'm the only brother.
Okay. Who's your favorite sibling and
Well,
why?
that's a very tough question. But in my case, there's sort of an easy answer. I have a baby sister. She's only 2.5 years old. So for now, I would say it's her.
Okay. And who's your least favorite sibling and why?
I don't think
If
I
you have to
don't
pick one.
if I had to pick one, I wouldn't really pick any of them, because like I don't think in terms of negatives. I like all three of them. I love all three of them. So there's nothing that I would say. There's not one of them that I would say is my least favorite. But yeah, I wouldn't really pick.
Okay. Um, what is one thing that you love about your dad?
So the best thing about my dad is that he's extremely reliable. He is always there for me whenever I need him.
And what is one thing you love about your mom?
She's very compassionate, so that's a very important quality for me as well. I've learned that growing up, and compassion is something that's very important to me as well.
What are a couple of things you wish your dad didn't have?
So he works too hard. No, I still wish he did have it, but it has its downsides sometimes.
Okay.
Yeah.
And what else?
Aside from that, I would say that that's actually a very interesting question because can I have a minute to think about it?
Of course, of course.
So I guess the other thing is that I've seen him, he gets very invested in things. Aside from that, so he has a tendency to overinvest in projects and things. That's a quality I think that could be toned down a little.
Okay. And what about your mom? What are a couple of things you wish she had a little different?
So that's linked to her compassion as well, because there is such a thing as being too compassionate. Sometimes you have to you have to be you have to tone it down for your own sanity.
Okay. Anything else you
No,
don't like about her?
no, there's nothing I don't like about her.
Or
Most of
you
these
wish to
things,
change?
yeah, not even change because this is what makes them who they are. These are the things
Sure.
that we love about them.
Okay. If you're on an island by yourself, stranded, what are three things you wish you had?
So the most important thing would be my Kindle because it has all my books in it. Aside from that, probably get a supply of clean drinkable water and a mattress probably.
Okay. What is something that irritates or annoys you?
But I generally tend to think of myself as a person who is not annoyed easily. But sometimes some habits can sometimes be annoying, but they're not usually beyond what is controllable. I don't like it clicking of pens and crackling of knuckles, but that's not something that really bothers me. It's not even to the level of a pet peeve.
Interesting. Okay. What do you think are your three biggest strengths?
So that's a very interesting question. I like analyzing myself in this term. So I would say that my biggest strength would be that I'm a strategic planner. Like I enjoy thinking strategically in terms of resources that I have and planning my goals and subdividing them and making them into achievable targets. This is what I did with my hand motion analysis project. This is what I've done throughout my medical school, that I think of the resources that I have and then plan them out. So I'd say that that's one. Uh, Secondly, I feel that I enjoy learning a lot. Aside from medical school, I've had a lot of endeavors where I've tried to learn new things. I learned French during normal course of my school, but I've tried to keep up with French, going through online courses again and again to try and to keep that connection going. I've tried to learn programming on my own. I have a good understanding of object-oriented programming, and that actually came in handy when I was doing the hand motion projects here because that required some knowledge of programming, and I was able to incorporate it. And my third greatest strength, I think, surprisingly, would be my ability to be as a team player and to lead, because these abilities I picked up during medical school. And I feel that I can be a reliable and dependable team player.
Okay. Interesting. Thanks for sharing those. What are your three weaknesses?
So my weaknesses would be pretty linked to my strengths. As as I've said, I'm a strategic planner, but there is such thing as planning too much. So there has to be some flexibility in your planning because you can't plan for everything. But I'm cognizant of this fact, and I've been working on making my plans a lot more flexible and to allow for a degree of failure in meeting those deadlines to have more realistic expectations of what I can do. Secondly, uh, regarding learning, I think that sometimes I fail to recognize my own limitations in terms of what I can do in a given time, because I want to do everything. I want to learn a lot of different things, but time is a limited resource, and sometimes I tend to ignore that fact and try to do too much at one time. So I'm cognizant of that fact, and again, like with planning, I'm trying to take it slowly, trying to understand my own limitations. And the third thing I would be that I enjoy helping other people a lot, but sometimes I put the needs of other people beyond me and that above mine, and that could sometimes obstruct my own paths. Sometimes that's important, but sometimes I feel it's really important to help other people as well, because that's how you grow.
Interesting. Interesting. If you could go back in time, um, and let's say you go back in time 10 years back, what advice would you give to your old self?
That's a very interesting question. Well, if I could go back 10 years and 10 years back, I would tell myself to learn more about programming, learn more about data science, and become even more adept at it, because these are the skills that will translate to success in the future.
Okay. Where do you see yourself in future, 10 years from now?
So 10 years from now, I see myself hopefully as a practicing radiologist, able to help as many people as I can, working in a high volume setting, seeing lots of patients, helping underserved populations most of all.
Okay. What's your biggest fear?
Oh, that's an interesting question. I would say my biggest fear would be of not being able to perform at the best of my abilities, because a lot of my life has been training and leading up to a point where I'm able to perform at the best of my abilities. A lot of this time has gone into this. So if I'm not able to help my patients to the best of my abilities, if I'm not able to be there for them, then I think that would be that is what I fear the most.
Cool. All right. Well, thank you. Thank you very much, Dr. Ali. You did very good. Do you have any questions for me?
Actually, I have a couple of questions for you if you don't mind.
Sure, please.
So So I see that you have a very diverse program with very high case volumes, and your residents all seem very genuinely very smart. I wanted to know if there was a procedure or a skill that you feel that you do not get enough practice during the course of routine practice at your program.
Believe it or not, it's actually the lymphatic leak. Once we will only get like 2 or 3 cases a year of lymph node injury in which you have to coil uh, lymphatic. Other than that, I think we have pretty much everything and anything. Sometimes they're like thyroid biopsy. I don't know where you put them. Some people put them under ultrasounds umbrella. Some people put them under body. So at our department, ultrasound does them. IR doesn't do them, but that's a valuable skill. Other than that, anything and everything from interventional oncology, line access, bleeders, trauma, we do them all.
That's very interesting. So another question, if I may.
Mm-hmm. Of
Yeah,
course, please.
I was going through your research and I found a paper that particularly resonated with me. So it was regarding four-dimensional phase contrast MRIs and how you compared them to an older two-dimensional sequence. My question was that is research regarding different MRI phases, because it's a very hot topic these days, using deep learning sequences with MRI to see whether we can get better images in shorter time. Is that an active area of research in your program?
Not in this program, I'll be honest with you. I think that is happening in bigger programs, like bigger university programs. I did that research when I was at Stanford University. So I know Stanford and I think UCLA and a few other programs are doing a lot of research on that topic right now. Yes, they have brought the scanning time down significantly from 40 minutes to like 2-3 minutes, and they formed a company out of all this research, Arterisys, and I think that is the first FDA-approved AI company. And they're doing a lot of now cardiac and non-cardiac stuff as well, not only MR but also, using AI. They're applying those AI models to CT as well. So unfortunately, in our program, I will say the most of the research is initiated and led by residents. We don't have a very strong faculty that, like, because we have a lot of clinical volume, so our faculty is focused towards that. We do have a couple of people who are big on research, and that's what they do primarily more than half of the time.
Interesting, very interesting.
Are you
So
looking to go to a program where you want to focus primarily on research?
my primary focus will always be on the clinical side of things, but research is a nice side project that I'd want to do. But my primary focus again is on the clinical side of things.
Okay, I'll be honest, it's not like we don't have any research. We had 2 residents in the past 5 years who did Homan pathway. Are you familiar with the Homan pathway?
So it's the research pathway. If
Right.
I'm
You do like a more than a year of dedicated research, and you do shortened clinical rotations. So we had 2 people who did that. One of them did a lot of research on cardiac stuff, and the other one was mainly neuro. So we can accommodate something like that, but mainly we want our residents to be very well clinically trained.
Yeah, that aligns well with my goals.
Okay, perfect. Do you have any other questions for me?
No, I'm good. Thank you so much.
Okay. All right. Well, thanks for interviewing with us, and good luck for the match.
Thank you.
All right, feedback time, Hamza. How do you think you did?
I don't know. I would say I did fairly okay. Like
Yeah,
could be
you did
better.
good. Could be
Could be
better. You did good. I think, were you nervous?
not really nervous, but some of those questions really did get to me. So yeah.
So I'll tell you, you probably might feel the stress for those because of those challenging questions. You were doing pretty good, but let me tell you this: the questions that you weren't prepared for, the difficult questions, you did better than the questions you were prepared for. And let me tell you why. The reason was that I think you kind of over prepared. So especially with your, I'm sure you will go back and listen to all this and watch your interview. So once I told you, tell me about yourself, you just went, and you started talking at a pretty rapid pace. I'll say take a breather, take some pauses. When you complete a sentence, just give a small pause. Um, give yourself a breather and try to speak. Again, you do pretty good in all the other interviews you have done. You did pretty good, but I think it was especially in the start. Before you got comfortable, you were a little too fast. I think just slow down just a little bit, not a whole lot. It wasn't like super duper fast, but your eye contact was very good. Your smile was very good. Your setup is great. You were well prepared. You were very well prepared because there were a lot of questions that I was throwing at you, and you had good answers. But then I had to be creative and come up with some really interesting, unique questions that you could not think of. But you handled them with a lot of grace and dignity. So kudos to you for that.
Thank you. What would you hire me?
I would. Yes, absolutely.
Great. I'll work on this thinking of speaking slowly.
Yeah. Just slow down. Just take a breather. Nothing wrong with even taking a sip of water. Just take pauses between your sentences. And again, see, you're trying to refine something that is already pretty good. Your interview was very, very good. So don't think it as a negative feedback. It was a great interview. You did very, very good. I will just try to tell you, just slow down a little bit to make it even better.
Okay. Thank you so
Okay.
much.
You're most welcome. Anything else, Hamza?
No, I think I'm good.
Perfect. All
Thanks.
right. You're welcome. I hope you all learned something from this mock interview. If you did, please like this video, share it with others, and subscribe to the channel. And like we always say, never give up, never lose hope. Bye.